All right, thank you for that, Catherine. Our COVID-19 coverage continues now. We've heard a lot in recent days about West Virginia being especially vulnerable to coronavirus. Our Nick Dugan took a look at it much more closely today and sat down with a medical professional about answers for that designation.
Over the last week, Governor Jim Justice has continued to emphasize one point in particular.
But we've got to realize just this. We are a very high risk, if not the highest risk state.
But what does it mean to be a high-risk state? Clinical Director of Primary Care at Princeton Community Hospital, Nancy Lohace, explains it's all about the state's population.
So when we look at West Virginia, we have certain demographics that show that we are indeed at very high risk.
This chart provided by the doctor lists a number of factors that increase a person's risk for contracting a serious case of COVID-19. Three of the largest factors include high blood pressure, diabetes, and COPD. Studies show that West Virginia ranks first in the nation for patients with cardiovascular disease, second in the nation in diabetes, and again, first in the country in residents with COPD, who are 2.5 to 11.5 times more likely to be infected seriously by the virus. Dr. Lohace says the solution is simple.
My new motto for patients who are at high risk is stay home, stay healthy, stay away, don't go out. Have people bring things to you and drop them off at the door. Whatever is necessary to stay away from this disease if you are high risk, it's very important.
And that was our Nick Dugan reporting. Dr. Lohace went on to say that the primary care providers are hoping to conduct most of their meetings with patients via telehealth. Now, this is an effort to better protect both the patients and the medical professionals.